But bear with me. These breakout rooms are okay. So Samaria, Danielle. Danielle's not here yet. Okay. Juanita.
Professor Marble, Danielle is trying to get in. She said she got kicked off the first time.
Okay, I don't have anybody in the waiting room, but I'll keep watching for her. Thank you. Okay. Almost not here yet. Haley. Caitlin Ricard, is that you? K-A-T-E-L-Y-N?
Yes, ma'am.
All right. Okay. Kyle, Shannon. Let's see, Kyle, Shannon, Megan, Tracy, Hillary. Right. And one more group here. Ashley, Amanda. I don't have Amanda. Amanda's not here. Jasmine. Vana. Vana, is there a
Giovanna Bryant.
Oh, where are you? Oh, there you are. Okay, so you have to go in group 3. Okay. 3. All right, so there you guys go. Okay, you guys. Okay, Vana, I need to get you into, let's see. One, 2, 3. To add you in there. Put in. I'm trying to figure out how to get you in, Vana. Hang on a second.
Okay.
Participants. Unassigned. Okay, assigned to room 3. There you go. And then Danielle, I'm sending you to let's see. Oh no, I didn't want to do that. Danielle, you're going to room 1. Okay, and then Atifa, did I miss you? Hang on a second. Tifa. Tifa, what is your last name? Williams, there you are.
Hello?
Yes, we're here.
Okay, can you hear me now?
I can hear you.
Okay.
and not I'll put it in to you guys instead of like everybody.
Yeah, I would prefer the
Questions and then the part that says why is these answers correct? I can do that first part.
Okay. Let's see.
But I don't know, the one that I was looking up, let's see. Gotta pull it back up. My iPad went out. Crap, it's dead.
I could do the educating parents on risk of childhood obesity.
I had the one that I was,
Megan, you said ours is case study number 1, right?
Yeah.
I'm trying to pull it back up. My iPad just went out.
Yes, I could.
Was it in the email? I forgot where she sent it to.
It's only announcement.
Don't make sense.
Okay, so.
in progress.
Professor, my volume was not working, so I left and tried to come back.
Oh, okay. Let's see. You are in
Group 1.
group 1. Hang on. Let me. Group 1. There you go. Was that helpful to do that?
Yes, ma'am.
We've got a lot of different campuses represented, so it's nice to meet others. And why do you think we have group activities? Why do you think group activities are important?
They'd be able to like see other and hear other views or just different points other than your own.
Mhm. Lots of our nursing profession is focused around teamwork and communication and wait till everybody comes back in here. You know, there's a reason we have a couple of group activities in this class. It's important to work on teams. It's important to learn how to effectively communicate, how to be a good team member. In nursing, we're always working on teams, or whether it's working with doctors or other healthcare professionals or teammates. So give me some strategies you guys might think about. I mean, I'm assuming this won't happen, but what do we do if our teammates aren't participating or our teammates aren't agreeing to do what they said they wanted to do? What are some barriers you might face, and what might be some strategies for teamwork?
We can just offer the other teammate, options, what they want to do, and hold them to that.
Yeah. Because does anybody work with anybody that's a little bit difficult to communicate with?
Yes.
Yep.
Okay. And so when you're trying to get something done, or what do you do? What are your strategies? Don't say ignore them.
Right now, yeah.
What do you do?
We're figuring that part out now. I think you do what you can. And I guess if you have good communication, it's your approach. If you ask someone to do something versus telling them what their role is and what they need to do, we're seeing that every day now. So just, we're all adults. Just ask me, and we may get behind, but that's part of being human. And you could check in with me, but it's just the telling versus asking can get a whole lot. The difference between getting a whole lot done and
Absolutely. Right. It's always important to be a good teammate, and everybody has different roles. Some like to be the leader and the organizer. Others just like to just tell me what I need to get done and I'll get it done.
You gonna give me some coffee?
So yeah. Okay. So was that exercise helpful to meet everybody? At least start the process, exchange contact information. This is the first term I've done that. I just thought it'd be good for everybody to get in small groups and meet each other and get a plan going. So, okay.
Hey, I have a question.
Yeah, sure.
So the project, you basically like answering the questions and tell why it's correct, why the answer is correct.
Yeah. So good question.
So if it's 4 group members and 3 questions, how has it been done in the past?
So you split up, each group has one case study, right? In the module, there are guidelines, but let me go through them real quick so everybody's clear. Okay. I realize that everybody in the same group is going to have the same paper. Okay. So I realize you're going to be submitting 4 of the same final papers. Okay. But everybody has to submit something because that's how it populates into the grade book. Okay. So it should be a paper, however long it takes, 2 pages, 4 pages, depending on your case study, right? You should have a cover page like you did for your professional development plans. By the way, those were beyond fantastic. Enjoyed reading every single one of them. They were fantastic. Just Really good job. And you guys did great with the format as well. So just do a cover page with all your 4 names on there, you know, a APA cover page, what case study you're doing, and then in the body of it, do the case study. Bullets, paragraphs, whatever, however you want to present it, and then have your reference page. Okay, my suggestion is instead of copying and pasting it into the discussion thread, because that's where it goes, just attach it. There's a place to attach a document in the discussion post. You guys know how to do that? It says attachment. Just attach your paper rather than copying and pasting it and put it in the body. I mean, if you want to do that, that's fine. But just attach it as a document. Okay, and remember that's due next Wednesday. And that's in your, it's treated like a discussion question. And the reason why it's due next Wednesday, a week from Wednesday, because that'll be week 3, is because you have till Sunday to do a couple of peer responses. All right, so then you're going to open up somebody else's document, somebody else's case study, and give your feedback. Does that
Okay,
answer
thank
your
you.
question?
Yes, ma'am.
So everybody has to submit. And I know there's going to be duplicates
Question.
because
Okay,
you're
I
all
just want to
turning
make
in.
sure.
Go.
I want to make sure I was comprehending this right. Because when I read the instructions, I looked at it as if like, I almost feel like we're doing rationales almost. Because it's like, it asks why was the answers correct, why was the answer not correct. So that's how I looked at it. Basically, like each answer choice should have a response almost. That's how I looked at it.
And yeah, and one of the questions, one of the case studies does ask that. Why is this answer correct? Why? Yeah. Yep. Any other questions on that? Okay. All right, let's get to some content here. I'm going to show you, pardon me, just by show of hands, how many people have reviewed the PowerPoints for the last couple of weeks, done any reading for the last couple of weeks? Do you guys know what concepts, what topics, what chapters we're covering? Because if you haven't, really what I'd like to do is I'd like to go through and show you how you should attack all this, okay? Because everything's connected, okay? So the PowerPoints, let me share my screen here. I'm going to go right to our book. Okay. Pardon me. So I'm up in northwest Wisconsin, and we've got about 3 inches of snow on the ground. So it's cold up here. Okay, so I'll go back here. Everybody has access to their book, correct? So I'm pulling up chapter 1. This is how you attack your studying, okay? You do not have to read every chapter from start to finish. Okay, you just don't. I mean, in the first 2 weeks for this next upcoming exam, there's 9 chapters, okay? You don't need to read every chapter from cover to cover. So what do we need to know in each chapter? Okay, a couple things. This chapter outline is a summary of your PowerPoint. That's how we make the PowerPoints. Okay, now your PowerPoints have a little bit of information in them, but they're a summary of the chapter. So when you come and look at the chapter, you'll be able to see the chapter outline. And if you've reviewed your PowerPoints, you'll see that it's similar. Okay, what we really need to focus on is the objectives. Okay, this is what we need to take out of each chapter, the objectives. Okay, so after reading the chapter, the student should be able to this first chapter has six objectives. That's what you're after. That's the information you're after in the readings. Okay, so if you read through, let's see, state the mission and the core functions of public health, essential health, public services. First, you go into the key terms, okay, because there's a lot of words in the objectives that you can pull up under key terms. All right, so for example, let's take objective number 3, describe what is meant by population health. Well, let's go to our key terms. Okay, here's population health right here. Okay, you click on population health and it tells you exactly what population health is. Does that make sense? So that's how I want you to tackle your readings, by first reviewing the objectives and then seeking out the information about how to answer, because the exams are put together based on objectives from the chapters, from lectures, the PowerPoints, and keywords here. Okay, so that's how we put our exams together. All right, so I just want to break that down for you. Okay, and then let's say mission, state the core mission of public health. Well, let's go back up to our chapter outline. Okay, well, here, right here, public health core functions, right there. Okay, so do you see how everything's connected? You should read the objective and then go up to the outline, pick that area and read about it. Okay. Number 4, identify barriers to the practice of community and prevention oriented population practice. Okay. So let's go through the first one. State the mission and core function. What do you think public health is? What's public health? What are public health services? What's public health? Anybody have an idea of what public health is?
Like screening and prevention.
Okay, here's a good box right here. Okay, public health in America. What's the vision of it? What's the mission of it? Healthy people in healthy communities. That's the definition of public health, right? We want to promote physical, mental health, prevent disease, injury, and disability. That's your overall definition of public health. Okay. What do we do in public health? Community health, public health are often used interchangeably. And here are some of the things that we do in public health. We try and prevent epidemics and the spread of disease. We do a whole section on environmental hazards, preventing injuries, promoting and encouraging healthy behaviors, responding to disasters, and assisting communities with recovery. Okay. There's essential public health services by core function. Okay. Our core functions in public health are 3 things: assessment, policy development, and assurance. Okay. So if you're asked on the exam, what are the 3 core functions of public health? Here's your answer. Assessment. How do we do assessment? Monitor health status to identify community health problems, diagnose and investigate health problems and health hazards in the community. One thing you have to remember about community and public health is we use the nursing process as well, just like you do in your current work settings or your clinicals. ADPI is used in community health too. One of the things that I will help you learn is that we need to be able to look at ADPI from a community setting. So for example, your assessment process of admitting a patient to the hospital is a lot different than your assessment process of doing an assessment in the home. And remember, in community health, you have all sorts of clients. You may have an individual client, you may have a family that is your client, you may have a subset of the community that's your client, say the homeless or the vulnerable population. But the three core essential functions of public health are assessment, policy development, and assurance. Okay? So there's our first objective. And I'm not going to go through each objective in all 9 chapters, because if you haven't prepped and done your reading, then you're going to have to do some legwork on your own.
Did you
Describe
say
what is
insurance or assurance? Assessment-
assurance. Right here. I'm on page, review this box, page 3. Public health in America. That gives you, there's your general kind of overall vision, mission, what's public health all about, all summarized in this box on page 3. Okay. What are some other let's do what. So one of the things we need to understand is the difference between, in this chapter is an introduction, public health, nursing, and population health. Well, population health is exactly what it says it is, caring for a whole population. That may be your community, or it may be the state you live in. Population health, you're focusing on an entire population. Okay. So we've got 2 ways to tackle population health to answer the third objective. Oops. I'm going to get down to here, population health on page 2. The one thing we need to understand about, sorry, community nursing is a different, there's 2 terms to understand. We need to understand the difference between community-oriented nursing and community-based nursing. Okay? And you'll get asked about this on the exam. Community-oriented nursing, I remember it, the way I remember it is you're trying to orient yourself to the whole community. Okay? You're trying to figure out who your population is. Are they healthy? Are they not healthy? What's working in the community? What's not working in the community? So you're doing a general assessment for the whole community. Okay? Looking at the community as a whole. So I consider that trying to get oriented to the community. Community-based nursing is you're already working in the community. So you may be a home health nurse, a hospice nurse, a school nurse. You're already working in the setting, taking care of the ill. Okay, so that's an important distinction, and you will get asked about that. Okay, what's community oriented, what's community based? Here's your whole section on population health. Okay. Okay. So does that make sense? Okay. What are social determinants? You're going to see the word determinants a lot during this term. What it basically means is what determines the health of the population. And in community health, we focus on social determinants. And so this is an important one, number 5. Well, if I go down to your key terms, I have social determinants of health. Okay. And there's 5 of them. think there's a box here. Hang on. Sorry. Where is it? There's 5 social determinants of health. Sorry, I have something stuck in my throat. And social determinants of health, right here. Okay, so I'm just helping you find, you're going to be doing this on your own for the other chapters, but social determinants of health, what are they? Housing, transportation, safe environments, access to foods, economic development, and social support. So when we look at a community, this is on page 7. This is how we determine the health of the community. We call these social determinants. Okay, there's 1, 2, 3, 4, there's 6 of them. So every community has have these functions. Every community looks different. Some may have stable housing, some may not have stable housing. Some may have adequate transportation. Others may not. Some communities are safe environments, others are riddled with crime. Okay, so that's another, again, that's part of, that's one of your objectives. So we've covered 3 objectives here. Okay, you guys can do the other 3. Okay, so read your objectives, look in your outline, see if there's something you can click on that describes the objective. Click on that, read about it, look for keywords like social determinants of health or population health. We find them right down here. So does that help decrease the need to read chapters from cover to cover? You just don't have to. Okay, as long as you can answer the objectives. Let's go to chapter 2. Okay, let's go through the same exercise. Okay, what are our objectives? Okay, historical events. Discuss historical events and how they've influenced how healthcare is delivered now. Trace the ongoing interaction between practice of public health and that of nursing. What are some historical trends? Okay, who was Florence Nightingale? Who was Lillian Ward? Who was Mary Breckinridge? Those you can find, there's Mary Breckinridge right here. There's Lillian Wald right here. Okay, what were their contributions? Examine the ways in which nursing has been provided in community settings, such as settlement houses. How did the VA start? Official health organizations and schools. Okay, and then discuss the status of public health nursing in the 21st century. Okay. I'm going through some of these keywords that let me just highlight a few keywords that I really want you to look up. Mary Breckinridge, Frontier Nursing Services. We need to know, that's on your study guide. We need to know about Frontier Nursing Services, what you're going to get asked about them. What was their focus? Their focus was vaccinations. Here's a nice summary of Healthy People 2030. We're focusing on that. Okay. Florence Nightingale. We need to know about her contributions. How did the VA start? And Lillian Wald's contribution. Has anybody heard of Lillian Wald? Fascinating. So that would be chapter 2, the history of public health nursing. And then chapter 3 is what is the current status of our US and global healthcare. So again, going through the same process. Okay. Describe the events and trends that influence the status of global and US health systems. Discuss key aspects of the private healthcare system. Compare the public to primary care. When you see public, this is in your study guide, but primary care is considered private care. So we have 2 kinds of healthcare. We have private care and public care. Right? So how do we explain the model of primary health care? How is that explained globally, including within the United States? Okay, what are some of the changes we need in public health to have an integrated healthcare system? Go back to your chapter outline. Okay, here's your nursing and global health. Here's primary health care. And then how is our system organized in this country? Got a federal system, a state system, local. So how is our public health system set up? At the federal level, we have CDC. State level, we have our state health departments. Then we have our local health departments. Okay. I want to spend some time on the next chapter, chapter 9. What is evidence-based practice? We all should be using it. What is it?
Something that's been like proven to work time and time again.
Yep, it's part of it. Yep. Okay, so we should be all using evidence-based practice. Okay, evidence-based practice is how we improve our practice, right? We're always trying to improve outcomes for our clients. And evidence-based practice, well, let's take a look at it. Okay. This is done, we gather in our profession, we gather evidence from several places, from research, from clinical trials, from, where else do we get our evidence from? Studies, experts. And so we're always looking for the best and most current evidence to base our practice on. So in nursing, we're always looking at evidence-based practice. Okay, so it is what is the best current evidence that we have as we make decisions about the care of our clients. Okay, so right here. Okay, current best evidence in making decisions about the care of clients. Okay. So it's derived from science, social science, research, evaluation methods. Okay, so has anybody ever worked with somebody or currently works with somebody that says, oh, we've been doing it like that for 30 years. Don't worry about it. We don't have to change our practice. Anybody work with somebody like that? Nobody works with anybody like that?
Well, I don't work with anyone like that, but
That's
just,
good. That's,
um,
that's good.
well, I'm not in the medical field either, but, I mean, just being around in clinicals, like experienced nurses that has been doing it for a while, they will say, this is how I've been doing it, it works for me,
Right.
but
Right. So sometimes one of the barriers to evidence-based practice is buy-in. Okay. Is practitioners that, like you said, this is the way I've been doing it forever, it's working, and I'm a little reluctant to move forward and change my practice. And that's not a healthy attitude, especially in the field of nursing. So evidence-based practice includes the best available evidence. Here's an excellent summary right here. Okay, evidence-based practice is covered on the exam. Okay, the best available evidence from a variety of sources. Those sources could be, and I'm just highlighting here, I'm on page 157. Research, nursing experience, expertise, intervention, culturally and financially appropriate interventions need to be identified when working with communities. And this use of current evidence and the appropriate use of it also you need to think of it in a culturally sensitive and cost-effective way as well. Okay. Let's see what define evidence-based practice, understand the history. Provide examples of evidence-based practice in the community, identify barriers. Okay, let's talk about, I want to talk about barriers. It's right here. So your objective number 5 is right here. Barriers. Okay. Oops. Because this is important. So if you don't have buy-in to evidence-based practicing, using evidence-based practice, it's a real problem. All right, so although the community agency may subscribe in theory to the use of evidence-based practice, actual implementation, okay, may be affected by the realities of the practice setting. Okay, so in some cases, the community-focused nursing agencies may lack the resources. Okay, so that's a barrier. So lack of resources would be considered a barrier. Okay, what do we mean by lack of resources? Right, maybe funding, computer resources, knowledge. Second barrier, nurses may be reluctant to accept the findings and feel threatened when long-established practices are questioned. We just talked about that, right? So there's a barrier. Third barrier is cost. Okay. And then another barrier is compliance. Right? If you're expected to put new interventions into place, then and you're not willing to, then compliance is an issue. Okay, so public health departments are moving towards evidence-based practice, pardon me, and are seeking accreditation through national public health accreditation boards. What that means is evidence-based practice is becoming significantly more important in health departments seeking accreditation. Okay, and so here's your 4 barriers. Okay, so that answers your 5th one, your 5th objective. So does that make sense how we're getting there? Are you guys getting the gist? I just want to stop sharing for a minute. Are you getting the gist of how to go through these chapters and pull out the information you need to pull out? It's all right there for you. Okay, I do want to cover chapter 23. This, we're still from last week, which is fine. But chapter 23 is an important one because a lot of what we talk about in community health is equity, vulnerable populations. Oops. Health equity and care of vulnerable populations. We're going to talk about vulnerable populations this entire term. Okay, so here's a few important things. Okay, describe population health, its application for nursing practice. Describe health equity. Define the term vulnerable populations and describe selected groups who are more prone. Right? Describe individual social factors that can contribute to vulnerability. This is a really important chapter. Examine ways in which public health policies can lead to inequities. One of the things that I was thinking about doing, we're not going to do it today, but I would like to trying to stop sharing for a minute. I just want to bounce this off you guys. I was thinking about maybe spending some time at the beginning of class, breaking you guys out into groups again, and going through assigning a group an objective and spending 10 minutes answering that objective, finding it, answering it as a group, and then coming back and presenting it to the rest of the group. What do you guys think about that? I mean, I don't know how much preparation you guys do ahead of time. So, I mean, if you haven't done a lot of preparation for these 9 chapters, then you're probably looking at going back and doing 50 to 60 objectives. Does that make sense?
I mean, I prefer to just be lectured, but
You would?
know,
Okay.
yeah. But I mean, that's just me. I'm not speaking for everybody.
Well, part of the structure for class this term is we're supposed to spend about an hour on lecture, and then the other hour is supposed to be spent on an activity. Some kind of interactive, whether we do case studies, whether we do exam prep.
Do you know why those changes were made? Because to me, if it wasn't broke, don't fix it. I mean, we were, progressing.
Yeah.
As needed.
Right. And I'm flexible with that. We're covering 9 chapters today, so I'm totally flexible with that. But I don't know. I mean, it's up to you. I mean, I just want to get the information to you. I want to show you how the chapters are structured and how you need to tackle each chapter through the objectives, and how kind of easy it is to find the information in the book based on the objectives, whether you're looking at the course outline or key terms. So let's keep going. Let's keep going with chapter 23. So what is health equity? Really important in community health. What's health equity?
Equal health.
Health equity. Everyone has a fair and just opportunity to be healthier. Okay, really important. Okay. The other thing that's important, we already talked, what are determinants of health? And again, the determinants is the fancy word for what determines our health. We talked about this in a previous chapter, social determinants of health. Okay. Health disparities, that's another objective. We have to understand what health disparities are, right? These are differences. This is one of your objectives that exist among people or groups, population groups that prevent them from attaining their full health potential. Right? So we know that disparities exist across many dimensions, right? Race, ethnicity, gender, sexual orientation, disability status, socioeconomic status, and geographic location. Okay. What's a vulnerable population? So thinking about your community, what is a vulnerable population? What vulnerable populations do you have in your community?
Homeless people or homeless.
What are some other vulnerable populations?
The elderly.
Very old, very young.
Yep. Teen pregnancy, substance abuse, alcoholism. One of the, you're going to be doing, I think it's due in week 7, maybe week 9 for you guys, is a vulnerable populations assignment. Okay, it's a research paper. You're going to be picking a vulnerable population in your own zip code, and you're going to do a research paper. If you look in module 9, under the vulnerable populations link, it gives you all the guidelines in the rubric. And so that's not an assignment you start in week 8. So I'd probably get that going in the next couple of weeks, but vulnerable population, most of the care we do in community and public health is with vulnerable populations. Okay, so here's a whole section on vulnerability, definition and what influences. So vulnerability, page 407 is going to answer your 4th objective. Describe individual, define vulnerable. It's going to answer 3 and 4. Define vulnerable population and describe individual and social factors that can contribute to it. Okay, there's a whole section on it. Okay. Okay. Questions so far. Let's get into this week. Chapter 20, 21, and 22. Chapters 20 and these chapters are heavily represented on the exam as well. Okay, so family development, family assessment, and genomics. Okay, so let's look at our objectives for this. What do we want to know? Okay, it is family development, family nursing assessment, and genomics. So what do we want to know? What's the most important things for us to know from this chapter? Explain the multiple ways public health nurses work with families and communities. What are some challenges working with families and communities? Okay, we have to be able to understand the difference between a family function and a family structure. Describe family demographic trends and demographic changes that affect the health of the families. Okay, and work with families using what is a strength-based approach to assess, develop, and evaluate family action plans. Okay, so just before we get into this chapter, what are some ways public health nurses work with families and communities? What do we do?
Like, I don't know, maybe like educating them on different things, kind of like prevention measures, trying to prevent, them from getting certain diseases, or just educating them on different medical things.
Yep, education is a huge part of community and public health. All right,
Giving immunizations.
immunizations. Yep. What else? Think of what the needs in the community are.
Like,
Let's see.
I'm sorry.
No, go ahead.
Nutrition, trying to like have, I think they do have like programs where you can, if you can't afford healthier meals or snacks, they provide them, just like a prevention measure for like diabetes, or just teaching them about the nutrition as far as.
And having resources, that's big. A community nurse, public health nurse is a wealth of knowledge of resources. One of the ways we work with families is trying to, well, we go through the ADPI, assess what their needs are, right? And then we try and provide as many resources to them as possible. So that's another function that we do, is providing resources. We do education, we do a variety of education, like you just said, nutrition. What about new parents? We do teaching and education on parenting, bonding, infant care. I mean, there's a gazillion ways that public health nurses work in the communities. And remember, in the community, we are potentially working with clientele across the entire lifespan, all the way from babies all the way up to the elderly. So if you think of all the possibilities of the different kinds of clients you could be working with in the community, this is why this class is presented towards the end of your program. It's starting to bring everything together. And I think I talked about this last week. In the community, you're bringing everything together, your med-surg, your pediatrics, your maternity, your geriatrics, your fundamentals. It's all coming together. And the reason why community health, the reason why this class is so important is because it doesn't, wherever you work in the nursing setting, you're always going to be interacting with community-based people, okay, or clients or healthcare teammates, because patients go home from the hospital, they go home, they go to rehab, they go to long-term care facilities. These are all community-based places. And so you will be working with community people, community healthcare providers. Okay. Couple things from these objectives. We need to understand the difference, describe the family function and structure. No, there is right here, family function and structure. Everything is pretty easy to find. Okay, and I went through this with my other class. That's why it's highlighted. Okay, you're going to get asked about this on the exam, the difference between family function and family structures. Okay. So family functions, these 5 functions are part of the makeup of every family. Okay, whether it's economic, reproductive, socialization, affective, and healthcare functioning. Okay, those are the 5 functions that make up everybody's family. Now that looks different in everybody's family. Okay, but those are the 5 basic functions that make up a family. So knowledge of family functions and structures is essential for understanding how families influence health, illness, and well-being. Family functions are the ways in which families meet the needs of each family member, the family member as a whole, and their relationship to society. So there's your definition of family functions. Okay, these 5 make up how healthy your family is, how ill your family is, or unhealthy versus healthy. They also make up, you know, how we meet the needs of family members. Okay, so family structure, on the other hand, refers to what your role is in the family. Okay, so family structure refers to the characteristics and demographics of individuals who make up the family unit. So for example, family structure is defining the roles in the family. For example, I'm the mom, you're the dad, you're the kid, you're the grandmother, you're the dog. Okay, so family structure is pretty much the role definition. Okay. And box 20.1 gives you some guidelines of what different kinds of families look like. What does a married family look like? What does a single family look like? Single parent family, multi-adult household. Okay. So we just did number 3, describe family demographic trends and demographic changes that affect families. What kinds of demographic trends and changes do you think affect the family? What kinds of things, I'm asking, what kinds of things do you think demographic trends that affect the family? New children, new family members moving into your house, right? There's always evolving changes in health. Somebody becomes ill. Okay. I want to go over theories. There's a few theories for working with families in the community. Okay. The biggest one is the family systems theory. Okay. And I want you to review the assumptions of the family systems theory. Okay. It's these. Okay. Okay, these are the assumptions we're making when we approach it from a family systems theory. Right, family systems are greater than the different and greater than and different from the sum of their parts. I'm not going to read through all these, but I want you to read through all that. You need to read through these. You're going to get asked about family systems theory. And again, remember, a lot of this exam is prepped on these objectives. So if you have an understanding of these objectives, you're going to see them all over the study guide. Okay. There's a bioecological systems theory. Family systems is the big one, but there is a bioecological means how environments and systems outside of the family influence the development of a child over time. Okay. How does it shape the development of a child? Using the same principles. Using the same principles can be applied when a client is a family. Okay, so how is the child influenced? How is the family influenced? Okay. Some of the words I'd like for you to look up and understand in this chapter. Do you guys know the difference between a genogram and an ecomap? Okay, genomics, that's what this chapter is about. Okay, when we're looking at family assessments, there's two ways we look at it. One is a genogram. Genograms are hereditary. We go back 3 generations and do a map of who has died from what, hereditary functions. Okay, so so your family may have a history of breast cancer, history of cardiovascular disease, history of alcoholism. Okay, a genogram, genomics, goes back and does the history of what's been happening in your family so that you can predict risk for other generations. Where an ecomap is more the current social structure of your family. So an ecomap is what is your family, what is your family's social relationships in the community? Do you have work? Do the kids go to school? Do they play sports? Do you belong to a church? Do you belong to a rec center? What are your social interactions with the community? Okay, so it's important to know both of those. Okay, an ecomap versus a genogram. Okay. Family health risks is another important topic that's covered quite a bit on the exam. Okay, so let's start with our objectives. Determine the major risks to family health. I think that was early approaches. Right here, here's your section, major family health risks and nursing interventions. Okay, so what do we want to cover? What do we want to cover in this chapter? Health risks. So what we need to understand is there's health risks at every age group in the community, right? What are the health risks for infants? SIDS. What are the health risks for children? Accidents. What are the health risks for adolescents? Accidents, motor vehicle accidents. Okay, so this goes through, this chapter covers a lot. Okay, where it identifies the family. First, you have to identify, how do you define a family? Okay, how do you define a family now? Is there even a definition of a family? Or is whatever the makeup is? How do you define a family?
Nowadays, I mean, I would say just whatever the makeup is.
Exactly. Right. 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 Is there one definition of a family that fits all? Is there a new normal? You know, family is whatever the family says it is. Right?
All right.
This is a good section to read. Early approaches to family risks. Okay. How do we assess the health of the families? How do we assess the health of a nation? This comes from one of your objectives. Okay. Here's your healthy people objectives for family health risks. Okay, review this box, please. It's on page 361. Okay. These are important. You need to understand these definitions here. This is part of your objective. what's the difference between a health risk? This is one of your objectives. What's the difference between a health risk? How do you do a health risk appraisal? Right, where you're assessing for risk factors, specific factors for risk. What do you do? What does health risk reduction mean? Right, you're trying to reduce the number of risks, so you're decreasing the probability that an undesired event would happen. What's family crisis? It's a definition of family crisis. Family in crisis occurs when a family is not able to cope with an event. They become disorganized and dysfunctional. So please understand the difference between these. That's one of your objectives. Okay. Here's your genogram. Okay, so here's what a genogram looks like. It's called a biological health risk assessment, but it's your genetics. So this is what it looks like. So you go through and do 3 generations. Here's your first generation, your second generation, your third generation. What did they have? What did they die of? What conditions do they have? Okay, that's how we do the genogram. It's a historical family genogram of the Graham family. So it's a historical knowledge of health issues in previous generations. Okay. And then here's your eco map. It's considered under so you have your environmental risk and you have your biological risk. Biological is your genogram, and your environmental risk is your eco map. So that's how we determine how connected you are. Are you an isolated individual, family, or are you a socially engaged family? I mean, look what happened during the pandemic. Right, there's a good picture here. So here's a good picture of an eco map right here, page 367. So I use myself. I'll do my example. So I am in the center of the circle. That was my eco map. That's me in the middle. And I had all these social things going on. I was very involved in the community, right? Work full time, have extended family, friends, whatever. These were all my social networks in the community. What happened during the pandemic? All those outside circles went away, right? They went away. Couldn't see anybody. We were locked down. So what do we think happened? The social isolation really increased and provided a whole new set of issues. Would you agree? So
Definitely.
now people so my circle went from having 12 little circles around me to 0. Now we're all trying to build those social circles up again. Okay, so that's the difference. And we call this an eco map. So you have an eco map of the Graham family, and then you have a genogram of the Graham family. So there's your 2 differences. Okay. And then here's a section, one of your objectives deals with risk reduction. How do we do risk reduction? Okay, I need you to understand what the phases are of a home visit. Table 22.1. Okay. It's 5 phases of a home visit, because we're in the section now of what are some approaches we can take to family health risk reduction. And one is a home visit. In the home visit, You have our phases. So you may get asked a few questions on the exam that say, okay, I am going to be introducing myself and professional identity. What phase is that in? Okay, so have an idea of each of these 5 phases. Okay. They do follow along with the ADPI. Okay. You just have to look at ADPI differently. You're in the community now, not in the hospital setting. And then you just need to be familiar with this. You don't need to go through and read about every phase. That box is a nice summary for it. Okay. The other table I want you to have an understanding of is contracting. Okay, contracting. What is contracting with a family? It's a mutual agreement, right? And there's 3 phases for contracting: beginning, the working, and the termination. You may get asked a question. The question may be mutual termination of the activities, mutual termination of the contract. Okay, what phase is that? Okay, so again, just understanding these boxes, these tables is fine. You don't have to go through and read the whole section about all of it unless you want a better understanding. Okay. The 2 things I want you to review in each chapter are the levels of prevention. There's always a levels of prevention box. And there's always a healthy people 2030 box. Okay. Review all of those in every chapter. We need to have a really good understanding of the differences between primary, secondary, and tertiary. So let's just stop right here and review that. What is primary prevention? Primary, I just said it.
Yeah.
Prevention. So I do the P, primary is prevention, secondary is screening, S with S, and tertiary is treatment. Okay, be careful with the education piece. Okay, education, when I do reviews with students from exams or tutoring, somehow education is lumped into primary. Okay, be careful with that because education is lumped into all 3 prevention levels. Right? If you are educating in the primary level, you're educating towards prevention. If you're educating in the secondary level, remember secondary is early identification, screening. Okay, so if you have identified a person at risk, you're going to be educating them on how to reduce that risk, so it doesn't develop into something more serious. And then at the tertiary level, there's still education. Because remember, they already have something. They have a diagnosis. Let's say they have diabetes. Okay, your education with them may be continuing to support and teach them how to care for themselves with diabetes. So don't get caught up with education only being a primary prevention. It's at all 3. And that's why I always say primary is prevention, secondary is screening, tertiary is treatment. Does that help?
Yes, ma'am. And with the education, so if we were to be asked a question, will they like elaborate on the type of education?
Oh yeah, yeah. And there's several primary, secondary, tertiary questions on the exam.
Primary be like if they say they're teaching a bunch of students something, okay, that would be like primary. I mean, I guess depending on what the students have already. I don't know.
Well, I don't know. Does the question identify what if let's think of something. The nurse is teaching a bunch of elementary school kids on the risks of obesity. It doesn't say they have it, right? They're teaching prevention,
Gotcha.
right? So that would be a primary.
So if they're at a nursing home and teaching a bunch of elderly people or amputees or something about how to use like the latest walker or gadget or
Okay.
something, that would go on a
Tertiary.
Okay, because they
Because
already
exactly. Tertiary means they already have a diagnosis, a condition, they already have something. So now you're helping them manage it. Treatment.
Gotcha.
That's the whole difference with tertiary. They have something going on already. All right, so let's read these three. And this is related to families. Primary, complete a family genogram and assess the health risks for the family to contract for family health activities to prevent diseases from developing. That's the key. Prevent something from developing. That's clearly primary. Right? Secondary. I always consider secondary early identification, early intervention. So an example of a secondary would be used behavioral health risk survey to identify the factors leading to health problems, such as obesity. So you're doing a screening. You're trying to assess for risk. And then tertiary, develop a contract with a family to change nutritional patterns to reduce further complications from a specified health problem. So they have some kind of specified health problem. Let's just say it's obesity. So you're developing a contract with family to change nutritional patterns. You're helping them manage or reduce the complications from a health problem. Okay. So again, we're just going through, let's see, chapter 22. Here's your health risks across the lifespan. I want you to spend some time in this chapter. Okay. Look at how big the outline is. A lot to cover in this chapter. Okay, but start with your objectives. Okay, you need to be able to identify what are your major health problems of children's and adolescents. Here it is right here. Okay, obesity, injuries and accidents, alterations behavior, mental health, acute, chronic, okay. Target areas of prevention with kids, smoking, nutrition, immunizations, environmental health hazards. Okay, what are some risk factors? This chapter is all about risks across the lifespan. So describe risk factors for older adults. Describe risk factors for people in the community who have special health needs. Discuss risk factors for adults, including those different from men and women. Okay, and jump down here. Try and find some key terms that are going to support you answering your objectives. Okay, up here it says, let's see, number 3, discuss risk factors for adults, including those factors that are different in men and women. Well, here it is right here. Women's health concerns, men's health concerns. Okay. And then the last chapter was the school nurse. Okay, chapter 31. Okay, so again, what does a school nurse do? Anybody have any interactions with school nursing? I just retired from school nursing. I was a school nurse or a consultant in a big district in Colorado for the last 20 years. Okay, discuss the history of school nursing. Just describe, compare, and contrast professional standards, scope of practice. Describe differentiate the roles and responsibilities. Okay, the school nurse is much more of a public community health nurse. Okay, school nursing is very much involved in vaccinations and health education, immunization status. Okay. I want to spend a few minutes. You can go through these objectives in chapter 31. I want to spend a few minutes on the study guide, as I said I would. Okay. So I am pulling up your study guide. There's a cover page to it. Did it just, okay. Are you guys okay with me jumping to the study guide?
Definitely.
Okay.
Yes.
All right, so there's a cover page to your study guide. It tells you what chapters. Okay, so you're gonna have, I think, 9 chapters. 1, 2, 3, 9, 20, 21, 20, 21, 22, 23, and 31. Okay, so you can read through the cover page. All right, I just want to show you how it's broken down. Okay, so this first section is priority and safety assessments. Okay. This section, first section, comes from chapters 21 and 22. Okay, it's talking about risk factors, safety assessments. Okay, and it's a lot of generic information. Okay, but part of it comes from chapters 21 and 22. Okay, so as you read through each bullet, let's do the first one. Risk factors for SIDS include, and it gives you a list of all these risk factors. There's 5 of them. If you were going to get a question about this, what might the question be? What information are we giving you? Risk factors, right? So might your question be something like, select all that apply? I don't know, select all that apply that are risk factors for SIDS. That's the way I want you to think about this, okay? Is once you read this, okay, what are they telling me? What might they ask me about? Okay, here it says review the 2030 principles of safety for adolescents. Okay, what might be on the exam about that? Well, what are the principles? Well, it looks like violence is a principle, right? Motor vehicle issues is a principle. And it says, remember, these are the leading causes of morbidity and mortality for adolescents. Know why in nursing interventions. So if you get asked a question that says, what are the leading causes of morbidity and mortality for the adolescent? What are your answers?
Violence and motor vehicle.
Exactly. Okay. Safety assessments. Know what environmental things you should look for when assessing common areas and playgrounds. So I'd be going back to your chapter and looking up playgrounds. What would put a child at risk in a playground? What are safety recommendations? You see how I'm trying to pick out words or phrases from these bullets? I'm trying to figure out what might get asked. Okay. Review concepts regarding assessment of how health disparities play a role. We just went through health disparities. Read that section. Okay, understand the difference between primary, secondary, tertiary, and be able to distinguish the 3 and give examples of each. When prepping for a home visit, know your safety precautions. There's a box in that chapter about what are your safety tips for a home visit. Okay. This next section, acts and organizations. So that's legislative. Where do they play a role in public health? That would be chapters 2 and 3. right? You'll be able to find review the Family Medical Leave Act. So it's telling you, you need to know what the Family Medical Leave Act is here. So you're going to get it. You may get a question about that. Do you understand the differences between Medicare and Medicaid? Okay. What's the Affordable Care Act? And here's the Frontier. What is the primary focus of Frontier Nursing? We just talked about that. Vaccinations. Okay, here's your difference between what's a definition, examples of community-based versus community-oriented nursing. Okay, that's all in chapters 1, 2, and 3, that whole section. Okay. What's the difference between advocacy and social justice? Okay, it's given to you right here. What's advocacy versus social justice? If you have a good understanding, not memorization, if you have a good understanding of this study guide and can articulate it and understand it, you'll be in the 90s on the exam. I promise. Okay, so start with the study guide, and what you don't understand, then go back to your book, right? And do more research, do more reading. Okay. This next section, management of care across the lifespan, we just talked about. Okay, that's chapter 22. Management of care across the lifespan. Chapter 22 is health risks across the lifespan. Okay. School nursing, chapter 31. Okay, this says review the Healthy People 2030 objective for school nursing. So what are you going to do? You're going to go back into chapter 31, right? And you're going to find that box, because there are 2 boxes in every chapter. There's an intervention box. So there's a primary, secondary, tertiary box for school nursing. There's a primary, secondary, tertiary box for family development. Okay, there's a primary, secondary, tertiary box for every chapter. And those interventions they give are specific to that topic in the chapter. So this is saying review Healthy People 2030 for school nursing. That's pretty specific. Okay. And definitely review, well, you know what? Unless it is on here, unless it's your study, unless it's on your review the Healthy People 2030 boxes that it states in this study guide. So we certainly know we want to review the one on school nursing. I think there was another one prior, wasn't there? Please know this. CUSIN. CUSIN is a set. What we need to understand about CUSIN, it's a set of competencies. It's not a federal agency. It's a set of competencies. There's 6 of them, I believe. That's introduced in chapter 1. So know what your 6, well, it's telling you here. What is CUSIN? Quality and Safety Education for Nurse Competencies. What are the main objectives? Is it a federal agency? No, it's not a federal agency. Okay, it's a set of competencies. Okay. Okay, we just covered this, family assessments. This is chapter 20, this section, family assessments, home visits, primary, secondary, tertiary, healthy people principles. Okay, this is chapter 20. This section is chapter 20. Family crisis. What's an ECOMAP? What's a genogram? Tells you right here. We just went through that. Summary. Okay. And then your vulnerable populations and health risks. That is chapter 23. Okay. So again, these sections are also summaries. We have developed the study guide from the chapters and the objectives in the chapters, right? So a lot of what you're seeing in the study guide is the answers right from the objectives. But if you haven't gone in and done your objectives and, done your reading, a lot of this may look unfamiliar at the moment. Okay. And then the last section was evidence-based practice, and that was chapter 9. Okay, and I think we covered most of what's in evidence-based practice today. Most of what's in this section on the study guide. So that's how I want you to look at your study guide. So because now we're in a review prep, if you go to a review or listen to a recording, everybody's going to be using this study guide. Okay, we're all going to be presenting the same information in just different styles. So I would be using this study guide to mark up. All right, my suggestion would be to go through it and see what is familiar and what's not. Maybe highlight, yep, got this, I know about this, I've read about this, that was the objective in chapter 2 and got this. Or highlight something, I have no clue what this is, I have to go back in and research it, read more about it and get a better understanding of it. Okay. So, with all that being said, there's a lot to cover today, but is that helpful information? I'm trying to give you a roadmap, a very specific roadmap. I don't want you reading 9 chapters from start to finish. The objectives are the important parts of the chapter we want you to pull out. The objectives are supporting information of how to understand the concept of the chapter we're covering. Those are the most important things. Use your chapter outline at the top. I guess use your top and bottom, top of the objectives, bottom of the objectives. Use your course outline and use your key terms. And between your course outline and your key terms, you should be able to find all the information you need. And when you're pulled to a section, just read that section. If you're on a section of population health, read that section and that's it. Okay? You're not responsible for 9 chapters. You're responsible for information that leads to being able to articulate the objectives. Okay? And you'll see the study guide follows that to a T. Okay. Let's all pull up our week 2 attestation. Let's do that so we can get it done. And and everybody, make sure your name's in the chat for attendance, please.
You want us to pull up week 2 what? Oh, attestation.
Yeah.
Okay.
Yeah. And I believe it is this the primary, secondary, tertiary? And give an example of each, or was that last week?
That's this week.
This week, yeah. So what's primary? Prevention.
Prevention.
What's secondary? Screening. I mean, you could be a little bit more descriptive if you wanted to. If anybody wants to put their answers in the chat so people can copy and paste, that's fine too. So what would be, throw out some examples of primary? Education class to prevent obesity.
And
What
risk
else?
fact-
Education to discuss risk factors. Absolutely. It's all about prevention, preventing something before it actually happens.
What was the short one you gave again? I know like primary prevention, secondary, training, tertiary
Tertiary treatment.
treatment. Okay.
Treatment, that's just, it's management, treatment, because you already have something. So what would be an example of secondary? Screenings, surveys, you're trying to,
like screenings for diabetes, like blood sugars.
yep. How about mammograms? What would be an example? Let's go back to primary. How about immunizations? Right? Prevention. Secondary, an example could be mammograms or bone density tests or blood pressure checks or whatever. Obesity screenings, BMIs. It's all about assessing risk. Early identification, early intervention. That is secondary. And then tertiary is helping patients, clients manage whatever condition, disease, issue they have going on. So for example, maybe, how about teaching a group of elderly clients how to care for their diabetes? What else? Teaching or working with a group of obese high school students to reduce their long-term risks and maybe strategies for losing weight. They're already obese. Maybe working with, in a group home, working with the mentally ill, helping them with daily coping strategies, right? They already have they're already mental, they already have a mental health diagnosis. Okay. And then once you're done with that, just please hit submit. Then you're done with this. So what else is due this week? Your peer responses to the discussion question, and then your NCLEX, and everybody, and I don't know when this is going to get resolved from internally in the module, so everybody understands how to get to it, right? The other way for this week, so that I don't want anybody being late with the assignment, right? Everybody was participatory in that conversation at the beginning of class, correct? So you all know how to get in there the alternate way.
Yes, ma'am.
Okay. I know we covered a lot today. And so now I'm probably going to open up, well, let's see, you guys won't take it till next Friday. I'll open up the exams for you to download, and probably over the weekend. And then you have next week to study. Now, listen, I'm more than willing to meet with anybody, but I need you to do your own due diligence first. So after you go through and do your review for the exam, you've either gone to review sessions, you've listened to recordings, you've marked up your study guide, up one side and down the other. If after you do and study and do all your due diligence, if at that point you are having concepts that you still don't understand, please reach out to me next week and we can meet. Okay, I don't want to review the whole study guide. I'd prefer to focus on the areas that you're having trouble with. Okay, So please reach out to me next week if we need to spend some time reviewing sections of the study guide or just parts of your preparation that you're, and here's, well, if you listen to my review, you get them, but I start off the first 10, 15 minutes of my review on Wednesday going through test taking strategies for you guys. I'm not gonna go through them now because we only have 5 minutes left of class, but I don't know what the other professors are reviewing, but you know, if you want to review the first part of mine, I go through test taking strategies, what I've learned from reviewing with students over the last 2 years. So I know you guys, you know, again, if you have just spend the time, study for this, do well in this exam, and that way we're not playing catch up the whole term, because your next opportunity for a grade is not till week 6. Okay, if you have a good understanding of the study guide, you'll be fine. I promise. Okay. Questions? You guys will be fine. You got this. Reach out if you need anything.
I do have a question. For our case study, we have the part where you get to choose. We have case study 3, so you have to choose. And like, say if we do diabetes, do we have to pick like which type, or is it just in general diabetes?
I just want to make sure. Case study, that's case study 3.
Yes.
Just diabetes in general.
Okay. Thank you.
You're welcome. All right. I am finished for today. I hope you guys have a really awesome weekend. And then I'll stay on for questions. And then as always, please reach out to me if you need anything during the week. Okay? Please. Have a good weekend.
Thank
You
you.
too.
You're
Thank
welcome.
you.
You're welcome.
Thank you, Professor.
You're very welcome.
Thank you.